We are now going to invite someone to speak about processes that are directly related with these ones that we have just talked. We're going to invite an architect who's actually the project manager for GAIL Innovation, Sophia Schuff. She is a project manager, as I said. She develops research into social sciences, sustainability sciences, and social cultural complexities all across the work she does. She's got a background in anthropology, social development, and sustainability science, as I said before. She makes speeches and participates in congresses all across the Scandinavian region, throughout Europe. She's a project manager and she shares this concept. Foodscape that I mentioned at the beginning. She will be elaborating on that. And that is very closely related to the construction process we engage in. We've been talking about throughout this morning. And that's what I would like to have, her presentation, her talk, to help enrich.
Hi, my name is Sophia Schuff, and I am an urban anthropologist at Gehl Architects based in Copenhagen. I'm talking to you today about how we can make healthy, inclusive foodscapes for people, especially around how we can promote health, equity, and sustainability within the food environment. At GAIL, we make cities for people, and we believe that by applying a people-first approach to planning and the design of our cities, we can really work to combat different challenges around equity and health and sustainability. And the way that we work in cities is really about harnessing the collective life and energy that people bring to urban environments. We work in many cities around the world. We've worked in around 300 cities, small, very, very small towns to large mega cities. So very different typologies of places that we've been working. And our ethos is really about bringing life and form together, how we can make the urban environment, the built environment, a place that allows people to really flourish and life to be led in a equitable and healthy way, I guess you could say, in urban environments. And the way that we do this is that we really focus on life first. And this is a bit of a paradigm shift from how many people tend to work in cities. Usually architects and urban designers like Gale start with buildings and with the built form, but we really like to start with people. How do people move? How do people enjoy each other in the city? And then we think about how we can design space around that and that life. And then we work on the buildings and the built form. So we really like to start with life first when it comes to design. And when we study people and how people use the built environment, that's how we get the influence that we need in order to design cities. So the user experience is, of course, very important. And therefore, we really want to understand how people think and how they behave and what their kind of everyday experience is in the urban environment, and then design around that experience. We know that the built environment inherently shapes health. Health is definitely linked to place, and there is a lot of great research out there kind of describing what that connection is between place and health. And we found some, I think, quite startling evidence around the fact that it takes more than health care to really help people lead a healthy life. So 80% of health is shaped by non-clinical factors, whereas clinical factors shape around 20% of health. And so what I mean by non-clinical factors is really the kind of individual behavior that people lead and experience, what they are doing. the physical environment around them, so what they're experiencing, and then also social factors, education, employment, income, and whatnot. So we have a lot of different things coming in and influencing how people's health really looks like and is shaped in a city environment. And we know that place and public space can play a key, really important factor in fostering positive social health, social life, behavior, and of course, the physical environment. So, physical activity and how people connect to each other and the health that people kind of gain around the environment is incredibly important to people's kind of health and success. But what I haven't really touched on yet is food, which of course is incredibly important also to people's health and well-being in cities. We at GAIL really want to understand how architecture and urban design can influence dietary behavior change, and what is our role as designers in influencing people's dietary habits, what they eat, and how they eat. So this is the key question that we've really been asking ourselves. In order to understand this key question, we are focusing at the neighborhood scale, which means that instead of focusing on, I guess, the big policy changes or on very individual scale around education and somebody's, kind of personal decisions that they make in their lives, we are focusing on the neighborhood, the built environment, the street, the neighborhood, and how that kind of physical influence can shape people's everyday dietary behaviors and dietary health. In order to understand this, we focus on the environment and how it mixes with public life. So we understand the foodscape as food places, so where people access the food that they eat every day, as public life, how people meet each other in the public realm, outside of their cars, outside of the home, whether it's maybe in cultural institutions or on the street or in public spaces. And then of course the actual public space, the typology of the physical environment that people are spending their time in. And so when we look at these three kind of different aspects of how people experience the world around them, we really see that as the place where we can influence and invite for new behavior. And so the way that we do that, the way that we understand those different kind of places and how they influence people is through many different types of methods on kind of studying people's relationship with food in the built environment. And so what that looks like is a kind of toolkit, I guess you could say, of different types of methods and surveys to understand people and life. So we do intercept surveys and online surveys. We do different types of analysis of the built environment, mapping the built environment. We also study public life. We observe how people are interacting, what they are doing, and how they're spending time in the city. And we also talk to people through focus groups or interviews, all different types of studying, I guess, the lived experience, you could say, of a city. And the reason that we observe people is that it really uncovers many hidden needs, as you can see in this photo. By observing people in the way that they're using the city, we can understand that perhaps this is a space that, doesn't offer benches. And so people are using traffic bollards instead of benches to spend time or to wait for the bus or whatnot. So observation of life in a specific environment really helps us uncover the needs that people have that maybe they're not able to articulate through word. The challenges, however, that we're trying to solve are really, how is the built environment and urban mobility systems amplifying food insecurity? How can we understand how the kind of environment around us are shaping the way that people access or don't have access to food. The second challenge that we're trying to solve through this kind of data collection is also how can the built environment induce healthier unconscious food behaviors for people? So what this means is, can we understand that the built environment creates, just behavior that people don't even know that they're having in the environment? Why does somebody choose a healthy meal versus an unhealthy meal? And how might the environment around us be shaping those decisions? And the third question that we're really trying to solve is how might physical interventions, so us intervening in the physical environment, increase access, affordability, and the quality of food for local communities? So can intervention at the local, very hyper-local scale influence how people have access to good food? So with those three questions, we've been designing a roadmap for how we can understand a neighborhood's health and food access, and create a system in order to influence local interventions, and then create a kind of city-wide impact out of those interventions. So the first step is, as I mentioned before, data collection, really trying to understand people in their local context and where the everyday behavior happens for people. And then we study kind of user journeys and how people access food and other kind of healthcare services in their local, maybe neighborhood or district that they're living. And with all of that data, both qualitative and quantitative data, we then design local interventions at the neighborhood scale. So whether it's, safer walking streets or, affordable food options or capacity building for local food providers, it's really about interventions that everyday people can see, touch, smell, and interact with. Once those local interventions are put in place, we create evaluation metrics. So how can we understand success of these local interventions? How can we collect data on how the interventions are performing? And based on the learnings from the interventions, we scale up to other locations for bigger impact in a city. And so with all of that said, and a big background, I guess, to who is GAIL, what is this Foodscape data collection that we are doing, and what is the research that we're doing in cities, I wanted to share with you a case study from Bogota. We've been working with Cities Changing Diabetes for the last 8 months or so, studying 3 different cities. So studying Bogota, Philadelphia, and Houston, and what the Foodscape is in these 3 very different local environments in these 3 cities. The work that we did in Bogota was with the Health Secretariat, and was really, I think, quite a special project because it was linked to the city government, whereas the projects in Philadelphia and Houston were linked to local kind of nonprofit organization and to a federally funded clinic. So the project in Bogota that I want to tell you about was based in 4 different neighborhoods, very different neighborhoods from each other. Here you can see the 4 neighborhoods around Bogota, all at different quadrants of the city. And the goal of this project was to identify the relationship between the food system and the urban environment and how it dictates people's everyday habits. So it's really an information-seeking process to understand that relationship through the data collection methods that I described earlier. And the second goal was to create strategies and local interventions to achieve a positive dietary shift. How can we create these interventions that I mentioned on this Foodscape roadmap to really influence how people are accessing food and potentially choosing healthy food? So with those 2 goals in mind, our aim in Bogota was to try to understand food deserts in particular. In these four very different areas, they're all experiencing food, the kind of experience of the food desert. They're all on the periphery of the city and are quite rural, even though the kind of built context of each of these places is different. What we found is that there's a real diversity in the typology of these places. So there's a real difference in the kind of, here you can see here in the topography, some of these neighborhoods are very steep, very hilly, with very little ability for trucks to, for example, go up on the roads. But then you also have, in some cases, areas like this that are just kind of less developed than local areas in the city center. And this project couldn't have been possible without all of these wonderful volunteers that we had doing data collection for us. So we had many volunteers and coordinators found through the Health Secretariat, 64 volunteers going out and doing data collection. And what they did is went out into these 4 different neighborhoods over a span of 2 weeks and did this data collection process. So they went out interviewing local residents in the neighborhoods, observing how and where people buy their food or access food. They did vendor surveys trying to understand kind of how different local vendors of the food markets in these 4 different neighborhoods see themselves within the neighborhood. And based on all of that data, we were able to then create this study and kind of this research that came out of this project. So we really have to thank the wonderful volunteers that were out doing data collection in the 4 different neighborhoods. And so what I will do is talk you through some of the findings that we had from the data that they had collected, synthesized across the 4 sites. So what we could understand through the data collection is that processed food dominates the visibility in the public realm, and it's promoting an unhealthy food behavior. So what happens when everyday people see processed food every day when they're walking in the streets? 50% of the people that were interviewed across the 4 different neighborhoods don't believe that food impacts their health. And we found that 2 times more processed foods than healthy foods are offered in local stores. So this, of course, is really startling and begins to unfold why we see a lot of the diabetes and hypertension and obesity levels that we're seeing in these rural neighborhoods. We also found that neighborhoods are really experienced differently, and therefore a very nuanced approach is needed to how we address food insecurity in these neighborhoods. While 2 of the neighborhoods were less dense and lack fresh food options and have very little public space, 2 of the neighborhoods were dense, were much more developed, and had quite good public space where people were able to meet each other in the public realm, and there are vendors selling different diversity of food options in the neighborhoods. We also found that because these neighborhoods were so different, the quality of the food environment was also different. So we found that in the neighborhood that was, less dense and built up in a very difficult topography, that the lack of public space and lack of public sidewalks doesn't invite people to stay or spend time or meet each other. And so the primary food activity that we see happening is carrying groceries home, which of course is very difficult in an area that has a lot of mobility challenges. Whereas in the other 2 neighborhoods, there's a much greater diversity of food activities happening. We can see that, of course, carrying groceries home is happening, but you have more people buying food, people drinking or delivering food or eating fresh food, fruit or fresh food and vegetables on the street. You saw people out eating to-go meals together, and a lot of people in the food sector selling and serving food. So you can see a much greater diversity of food-related activities happening, and there's a great correlation to those activities happening where the public spaces are allowing that to happen. What's quite interesting is that, again, the difference between these neighborhoods, I know these graphs are always a little bit hard to kind of read when they're going quickly on the slide, but we could see that when there's a high quality public realm, there's also a diversity in the public life that's happening in that place and the mobility options happening in that place. So in the neighborhood that has much less options for buying and selling food and is much more rural and difficult topography, you can see that there's just no people around. People are not spending time in the public realm, not socializing, not spending time with their neighbors. Whereas in the other neighborhood, you see people greeting each other, spending time in parks, going to the store, buying food, eating on the sidewalks, being around in the public realm, and people and different kind of vendors and stalls buying and selling food. So there's a lot of different activities happening in those areas. When people were interviewed about how they feel about accessing food and what their capability of accessing healthy food is, people said that the primary thing kind of keeping them from accessing healthy food was the built environment. So you can see here in the interviews that we were doing in these different neighborhoods that while people's economic kind of status is a big barrier to accessing food, there is a bigger perceived barrier to accessing healthy food from the built environment. So the distance to food, lack of public transportation options, low quality of public transportation, and lack of sidewalks. We could also see from the data that the food environment isn't very inviting, but of course some vendors are starting to see this and they want to promote health. They want to promote good eating and healthy eating in their neighborhood. They're just struggling to find out how to do that. More than 50% of the vendors that we had interviewed said that they believe that they're bringing more than food to their communities. They want to serve people. They want to kind of give people a good quality of life and access to food. So I think this is something that's really important to keep in mind, is that vendors want to play that role, but sometimes don't know how or don't have the kind of provision from the government to do that, whether it's permitting or lack of space to kind of make that connection to their communities. And so based on all of these insights and data that we had collected, we created 6 pillars for building a healthy foodscape in Bogota. And those pillars are creating safe routes, identity. How can we create an identity around food and adapt traditional recipes to promote healthier kind of eating habits and rituals for people? Food culture, intensifying where healthy food is and how it's accessible to people. Food places, increasing the support for food vendors. And daily rhythms. How can we fit into people's daily rhythms with good, healthy, nutritious food? And lastly, deliveries, expanding micromobility options for an easier way for people to carry groceries home or get food from local vendors or markets to home. And so I'm just going to talk you through a few of these solutions that we had come up with in Bogota. So clustering food options along key routes. The reason for this is really about making healthy food the core spine of how people move throughout a neighborhood. Defining the shortest route, upgrading facades of food places, and solving physical barriers that keep people from accessing food. And it's really about safety, it's about lighting, it's about the quality of the environment and how food options are kind of densified along a key route from maybe the transport that people are taking home to home. And We created simple, really easy to understand prototypes or kind of interventions that the city and the health department in Bogota could understand in order to start this process. The next idea that we had for Bogota was in these neighborhoods was this kind of fun, exciting idea of a pop-up food salon. So instead of the beauty salon where you go to get your hair done or your nails done, it's a salon where you can buy food and understand the different ways that it's impacting your body and your wellness. So a fun kind of prototype idea that is a campaign really to get people to think about healthy food in a new, fun way. The second idea that we had, the second pillar that we had was around intensifying healthy food near places where people spend time every day. So intensifying the food options around home, around the transportation option, around recreational places. And we wanted to create an idea around fitting into people's daily routines with a concept that is actually doing very well in Bogota, which is the market, and bring markets and the idea around markets into cities and neighborhoods around the city where people actually spend their time. So if people are taking the bus home into these kind of villages from the city center, it sometimes takes a few hours to get home for a lot of these commuters. And so how can we create this link between consumers and the markets at a time when people are actually traveling? So really bringing the kind of market into a context that fits people's needs in a very comfortable and convenient way. And the reason that I wanted to show you this kind of example from Bogota is I think that there's a lot of learnings here that actually could be exported to a place like Rio. I think that Bogota is a very unique city that we were able to work. It's very different from Houston, Philadelphia, London, Copenhagen, the other places that we've been conducting Foodscape research. And it shows how these methods and how this process of studying the Foodscape can translate to a city in Latin America. And so our kind of key question for Rio is really, what might we uncover in the life and behavioral patterns of the Foodscape in Rio? This is really exciting question for us at GAIL because, you know, Brazil has one of the most biodiverse, landscapes in the world. And we really can see that Foodscape research in a city like Rio could enlighten us into how residents view their relationship with food when there's such a diverse and biodiverse kind of area that people have access to. And the second thing is that there is really a strong food culture in Rio. And of course, not all people, especially living in favela settings, have access to that strong food culture. While there is this historic food heritage and culture around food, this research, it might uncover new stories about how we can bring the traditional menu back, how families or women, the kind of head of households of families could bring, a lot of these traditional foods back onto menus. And I think that this methodology is something that's very translatable. We had, as I mentioned before, 64 people in Bogota going out and doing this research using this methodology. It's a chance to do capacity building and really help a local commune, or that's a Danish word, help a local municipality get the tools needed and the skills needed to understand what people's relationship with food is, and collect data and use that data to influence how you're going to shift people's health and diets. So with those three things in mind, I just wanted to show this triangle, because this is really how we think about creating the kind of healthy neighborhood foodscape strategy. It goes from this quick implementation on the ground and is a bottom-up approach. It's really doing those interventions at the local level and scaling up over time so that we can then later create that systemic change. We can learn from interventions done at the local level and influence planning and policy in the long term. Of course, it's a method that can be scaled. It's something where we start with mapping. We start with identifying places that people visit every day, try to understand where unhealthy habits and food behaviors are happening. And then we start to investigate public life. Where are people spending time? How are they interacting with each other? And how is the neighborhood kind of creating these different food habits that we see? And then we do these interventions. We install interventions and we learn from them. And I think this is an approach that's incredibly translatable and could be very relevant in a city like Rio. So I hope that this was enlightening for you and that you're able to kind of understand this idea around foodscapes and how the foodscape and the food environment is something that we can study, we can learn from, and we can use as informed data, as evidence to create a kind of change in lifestyle, a change in behavior, and hopefully an influence in how people's health is played out in the urban environment, incredibly different urban environments. So it was really nice to have the opportunity to share this with you all, and I hope that you were able to really get something out of this talk. Thank you so much. Bye.